Let me ask you something uncomfortable. If your doctor looked at you right now and said, based on your biology, here is the most statistically likely way your body will begin to fail after 60, would you want to know? Most people say yes. But then really, when the moment comes, they spend the next decade quietly ignoring the exact information that could help prevent it. Here is what is remarkable. After years in preventive medicine, there is one piece of biological data almost every person in this country has carried since birth. It sits forgotten on an old hospital form, tucked into a drawer, or buried somewhere in medical paperwork from decades ago. And yet, despite being available all this time, it remains one of the most overlooked indicators for predicting age-related disease patterns: your blood type. Not in the way diet books talk about it, not in the way wellness influencers oversimplify it, but through peer-reviewed epidemiological research spanning hundreds of thousands of patients across multiple decades. Research that increasingly shows something difficult to ignore. Your blood group leaves a measurable fingerprint on how your cardiovascular system ages, how your brain responds under pressure, how your immune system behaves when challenged, and statistically speaking, what may be most likely to take you down if intervention never happens early. Today, we are going through every blood type, O, A, B, and AB, and for each one, I will explain something most physicians rarely mention during routine checkups. Not because anyone is hiding secrets, but because, truthfully, a 15-minute appointment rarely leaves enough time to connect all of these biological dots. We are going to do that now. But stay with this all the way through because there is one modifier sitting above every blood type, something beyond the letter on your card that significantly changes personal risk profiles. And the surprising part is this: most people never think about it even once. Let us begin with type O. Type O is the dominant blood type on Earth. Roughly 45% of people carry it. And for much of human history, this likely provided a powerful survival advantage. Researchers believe type O blood emerged among some of our earliest ancestral populations, shaped by harsh environments demanding physical endurance, stronger immune defenses against parasitic infections, and digestive systems capable of handling large amounts of animal protein under stress. But what happens to that ancient blueprint once the body passes 60? Here is the good news first. On the cardiovascular side, type O individuals generally carry lower circulating levels of von Willebrand factor, a protein involved in blood clotting. Lower clotting activity means smoother blood flow, less platelet aggregation, and statistically, a reduced likelihood of arterial blockages that trigger heart attacks and ischemic strokes. Multiple large-scale studies consistently show that type O individuals face a meaningfully lower risk of coronary artery disease compared with type A and type AB combined. That is genuinely good news. But here is what almost nobody tells type O men and women after 50. That cardiovascular advantage can quietly become a psychological trap. This pattern appears again and again. A type O patient in their late 50s comes in. Blood pressure looks stable, cholesterol remains manageable, no significant family history of heart disease, and because everything appears structurally protected, they stop paying attention. Fatigue gets ignored. Digestive discomfort gets dismissed. Joint pain becomes something they simply push through. Because the most serious age-related vulnerabilities for type O individuals often do not come from the heart. They come from below it. The stomach lining in type O individuals expresses surface receptors that the bacterium Helicobacter pylori attaches to more easily than with any other blood type, and H. pylori is dangerous precisely because it rarely arrives dramatically. It does not usually announce itself through severe pain. Instead, it moves quietly. It settles into the gastric lining, colonizing tissue over years and decades. Slowly, almost invisibly, it wears down the stomach's protective barrier. What begins as chronic gastritis can progress to peptic ulcers and, in a meaningful percentage of cases, eventually gastric cancer. And the reality is this: gastric cancer discovered late remains one of the more difficult cancers to treat successfully. There is another important detail. Research also documents that type O individuals carry a measurably higher risk for certain peptic ulcer complications requiring surgical intervention compared with other blood groups. This is not speculation, it is documented evidence. So if you are type O, over 55, and have never been tested for H. pylori, this may be one of the most important conversations to have with your physician this year. Testing is straightforward: a stool antigen test or a breath test. Affordable, accessible, and for type O individuals, not routine caution. Targeted prevention based on your biology. Here is the type O longevity protocol. Your digestive system is your primary vulnerability. Protect it deliberately. Protect it consistently. That means limiting long-term use of non-steroidal anti-inflammatory drugs, such as ibuprofen and aspirin, unless medically necessary. These medications gradually erode the gastric lining in everyone. But for type O individuals, the reality is more concerning because they land on tissue already operating under greater biological risk. There is another practical layer many people overlook: fermented foods. Kefir, miso, kimchi, naturally fermented pickles. These are not trendy extras for type O bodies. They are practical tools that help maintain a gastric environment more resistant to bacterial colonization. And physically, type O bodies were built for movement. Type O blood is associated with higher baseline catecholamine activity. In simple terms, the nervous system often runs on elevated dopamine and norepinephrine compared with other blood groups. That can feel like energy. But really, if that energy never finds a physical outlet, something else happens. Restlessness grows, sleep becomes disrupted, and over time, cortisol regulation begins to break down. 30 minutes of walking every day and 2 sessions of resistance training each week may do more for long-term metabolic health than nearly any supplement stack people spend money chasing. Type O carries an inheritance of cardiovascular strength. But your stomach? That becomes your responsibility. And the mistake many people make is allowing the first advantage to create complacency about the second. Now let us move to type A. And if you are type A, lean in here because this is where the gap between what people know and what they should know becomes especially wide. Type A blood emerged as human populations shifted toward agricultural living. Denser settlements, more socially complex environments, greater exposure to infectious diseases. The immune system adapted. Type A individuals developed strong, highly effective immune responses, particularly against viral pathogens. During younger years, that is undeniably an advantage. But here is where the story changes. What protects you during your 30s and 40s can begin working against you by your 60s. Type A blood carries greater coagulation activity. Platelets become stickier. Clotting proteins stay more active. A landmark Harvard study following 819,500 adults over 20 years found that type A individuals carry roughly a 5% higher risk of coronary heart disease compared with type O. At first glance, 5% may not sound dramatic, but here is what makes that number clinically important. Stress biology. Because when chronically elevated cortisol layers itself on top of already sticky platelet activity, the compounding effect over decades becomes the real problem. The danger is not simply the number itself. The danger is what your body quietly does with that number every single day. And here is the layer most conversations completely miss. The issue is not only mechanical, it is hormonal. Type A individuals maintain the highest baseline cortisol levels of any blood type. Cortisol is your body's primary stress hormone. In short bursts, it helps. It sharpens focus, mobilizes glucose, prepares the body to respond to challenges. But when cortisol stays elevated week after week, month after month, something much more damaging begins to unfold. It inflames and stiffens the endothelium, the delicate inner lining of blood vessels. And here is the mechanism every type A man and woman should understand. When the endothelium becomes inflamed and loses elasticity, sticky platelets attach more easily, which means the elevated coagulation activity already associated with type A blood and cortisol-driven vascular inflammation are not separate problems. They amplify one another. Each one quietly makes the other more dangerous. And that is exactly how a modest statistical increase gradually becomes a real cardiovascular event. This means something practical. For type A individuals, stress management is not simply wellness advice. It is cardiovascular medicine. It belongs in the same category as blood pressure control and cholesterol management, because physiologically, it affects the exact same pathway. If you are type A and over 55, checking blood pressure every 6 months instead of once a year is not overreacting. It is clinically appropriate monitoring based on your specific biology. There is another marker worth discussing with your physician: homocysteine, an amino acid that, when elevated, actively damages arterial walls. Type A individuals tend toward higher homocysteine levels, but the remarkable part is how straightforward intervention can be. Adequate folate, vitamin B12, vitamin B6, dark leafy greens, eggs, legumes, and lean proteins. Simple, not expensive, not complicated, but highly specific to your biology. And there is one more thing every type A individual needs to understand. You need a daily cortisol reset practice, not a weekend retreat, not occasional meditation when life becomes overwhelming. Something daily, something consistent, something done every single morning before the world gets its hands on you. Clinical studies consistently show that diaphragmatic breathing, 4 seconds in and 6 seconds out, practiced for 10 minutes each day produces measurable improvements in cortisol regulation. And the important part is not perfection, it is consistency. 5 minutes every morning often outperforms an hour on Sunday by a significant margin. Type A carries powerful immune resilience, but it also carries elevated cardiovascular risk. Driven by a stress hormone, your biology tends to keep chronically elevated. Managing that hormone may become one of the most important health decisions of this decade. Now let us move to type B. And really, this is the blood type conventional medicine understands the least, while mainstream wellness culture often explains the worst. Type B emerged among nomadic populations moving across Central Asia and the Himalayan regions. These were populations constantly adapting, new climates, new food sources, new infectious pressures, and because of that, the immune system that developed became remarkably flexible metabolically. Type B individuals generally process proteins, fats, and carbohydrates with less inflammatory friction than many other blood groups when diets change. That adaptability is real. Historically, it was a profound survival advantage. But here is the problem most Type B individuals over 55 are carrying without realizing it. Type B carries a distinct immune signaling profile that researchers still do not fully understand. What studies consistently show, however, is this. Type B individuals appear to process environmental and dietary triggers differently from other blood groups. Research documents measurable differences in gut microbiome composition. And certain dietary triggers, refined seed oils, ultra-processed foods, high fructose corn syrup, appear to provoke stronger systemic inflammatory responses in type B compared with other blood types. The autoimmune picture remains actively studied. The science is complex. But one conclusion continues appearing across research. Keeping inflammation low through diet, movement, and regular monitoring appears to be the strongest evidence-based longevity strategy for type B individuals. And this matters. Because if you are type B and have spent years brushing symptoms aside, blaming fatigue, aches, or unexplained discomfort on just getting older, it may be time for a direct conversation with your physician about autoimmune screening. Early detection changes treatment outcomes dramatically. There is another modern life problem for type B individuals: the food system itself. Really, modern food acts like a calibration problem for your immune system. Refined seed oils, ultra-processed foods, high fructose corn syrup. These are not simply empty calories. For type B individuals, research increasingly points toward these inputs functioning as especially potent triggers for low-grade systemic inflammation, the kind that stays quiet for years while gradually distorting immune precision. This is where monitoring becomes important. C-reactive protein, commonly called CRP, is a standard inflammatory marker available through routine blood testing. For type B individuals, it should be checked at least once each year, and here is why. A consistent CRP reading above 1 milligram per liter without a clear infection may signal a chronically activated immune system. And if that signal stays ignored, eventually the trigger finds you before you find it. Exercise matters here too, but not all exercise. Type B physiology generally responds better to sustained moderate-intensity movement rather than repeated high-intensity bursts. Cycling, swimming, hiking, consistent walking. These forms of movement often support inflammatory balance more effectively than intense interval training that can temporarily spike inflammatory markers during recovery. Type B may be the most metabolically adaptable blood type on the planet, but that advantage comes with responsibility. Keep the immune system calibrated and it becomes one of your greatest assets. Ignore chronic inflammation, and over time, it may quietly become one of your greatest vulnerabilities. Now, type AB, the youngest blood type in human history. It emerged relatively recently as populations carrying type A and type B antigens increasingly mixed. And because of this dual inheritance, type AB carries one of the most unusual immunological profiles of any blood type. On one side, type AB inherited stronger immune tolerance tendencies. Research suggests AB individuals show lower inflammatory reactions to certain environmental antigens, translating into a meaningfully reduced risk for some gastrointestinal cancers and specific gastric pathologies compared with other blood groups. That sounds encouraging, but here is where attention becomes critical. Because what type AB gained in immune tolerance appears to come with another cost: neurological vulnerability. And the research is becoming increasingly difficult to ignore. Type AB individuals carry a statistically elevated risk of cognitive decline, including vascular dementia, compared with type O individuals. The mechanism is cerebrovascular. Type AB blood carries elevated coagulation factors inherited partly from its type A component, combined with the cardiovascular complexity of the AB antigen profile. And over decades, these factors may contribute to subtle but cumulative reductions in blood flow through the brain's smallest capillaries, the microvessels responsible for supporting memory consolidation. Processing speed, executive function. This is not dramatic blockage, not sudden collapse. It is gradual, microscopic. 15 to 20 years of subtle changes accumulating before many people ever notice what has already begun. Thanks for watching. See you in the next one.